Welcome to the MS&Me Radio Network. The broadcast shows are for informational and entertainment purposes only. They are not designed to provide listeners with specific personal, medical, or counseling advice. Individuals with a medical issue should always consult their healthcare provider. MS&Me is not responsible for content of individual shows. The views expressed by show hosts or their guests are their own. Enjoy the show.
Hi there. Welcome to this. This is the 62nd episode of A Couple Takes on MS. Hi, this is Dan Digman.
And hi, it's me, Jennifer Digman.
Excuse me, and welcome to this show. Boy, 2019's flying.
Yes,
Love.
it is. You are correct, sir.
Well, if you don't know or haven't listened to us before, or if you have, just a quick reminder, Couple Takes on MS. Jennifer and I actually have multiple sclerosis. I have relapsing remitting MS, and I've been diagnosed for 19 years.
And Dan and I met at an MS function in 2002 because I also am living with multiple sclerosis. And I was diagnosed in 1997. And I'm now living with secondary progressive MS. And when we met, it was love at first sight.
Truly.
And Dan, you're still coughing a little.
I'm still coughing.
Because
here's the thing. It was apparently, it was viral bronchitis is a thing.
Yeah, it's a thing that really kind of shook our world not that long ago.
It rocked our world. And following up with that, I mean that we both have MS, and we've been married now for 13 years. And just living with it, and couple takes on MS. It's obviously a couple with MS, but also taking it from different perspectives. What we're talking about, because they're coming up on Valentine's Day and everything, we're talking about in sickness and in health, and you're talking about this in a relationship. And I don't know if you've been listening to our shows, but it's just a couple episodes ago, we had done a show about what happens when the MS caregiver gets sick. Because what had happened is around New Year's, I came down with seemingly a cold, fever or something. And what happens with me, and I'm sure a lot of people with multiple sclerosis, when you get sick, it irritates, inflames your any MS symptom, and so when I'm running a fever, I can't function, and that's how it happened New Year's Eve. But at like 3 a.m, as we've noticed, fever breaks. I'm functioning again, because I have numbness in my hands and my feet. I have a hard time standing, walking, lifting my legs. Thereby, then makes it difficult to help you with transfers and everything.
And because the name of our show is A Couple Takes on MS, as you're listening to Dan talk, his MS, he's still walking and working, thank God. Which doesn't mean that God doesn't love me, but I haven't been able to walk for 16 years, and Dan is my primary caregiver. So when the caregiver gets sick, i.e. when Dan gets sick on New Year's Eve, that kind of upsets our whole world. And you're sick as a person just living with MS, but then me as the person who relies on you as my caregiver totally shakes everything. And we talked about, when the caregiver gets sick, unfortunately you had a fever on New Year's Eve. The fever broke. You were feeling better.
Boom.
We thought everything was so much better.
And we thought, hey, let's do a radio show about this. And no kidding, it was basically 4 days after we recorded that show, bam, the whole world. The fever came back, and I honest to God could not walk. It was all I could do to get up It was a Tuesday afternoon. I had gone to work on that Monday, and I'm just thinking, oh, I just don't want to work, but I feel okay. I'll just push through, see how I'm doing Tuesday. Tuesday morning, I woke up. I didn't get out of bed. Mid-afternoon, I'm running a fever. I have to go to the bathroom. I get up. I can't get to the bathroom easily. I'm grabbing onto things, trudging things. You end up, your caregiver, Marcus, who's here during the day, he had just left.
Yeah, because we thought you were, again, your fever had broken on the 1st, and you worked on that Monday. That was January 7th. And then on January 8th, you weren't feeling well, but Marcus and I went about our business, and he helped me in the bathroom, and he left. And as soon as he leaves, Dan also tries to use the bathroom. And that's when I went and I saw you just like a hump or a lump. I guess that's fair.
Yeah, a lump.
You were like a pile of just disheveledness. And he just looked at me and he said, I don't think I'm going to be able to help you in the bathroom. Not going to be able to help you be a caregiver, which instantly strikes fear in my heart. And my caregiver lives, quite a distance away, and he's just left our house not 5 minutes earlier. So I call on my cell phone. I'm like, I gotta call Marcus, because baby, there's no way you're going to be able to help me. Not to be selfish, but also you are not doing well. And with me being in my chair and having limited use of my arms, I'm not going to be able to help you.
Well, I think that's as we talk about this and what we want to point out, too, it's like a lot of times with you and me, and that we both have multiple sclerosis, sometimes our friends look at us like we're living the dream because we have a spouse who totally gets, who totally understands everything.
Like a built-in support group.
A total built-in support group and everything. But this is something, when we got married 13 years ago,
right.
Obviously you have these thoughts, you have these questions about what happens when one of us gets sick, what happens when this happens. Never did we envision, it's not that we've never gone through something like this before, but when it just up and slams you the way that it did this time.
And it did. That's a good word. It just slammed us. And, I'm a little weaker, as I've talked about with you on the radio show. I'm not using my arms as well. And when something like that happened, when you are that lump of humanity in the bathroom, all sorts of thoughts go through my head, all sorts of crazy thoughts like, what are we going to do? Thank God I have a medical alert. Thank God I have a cell phone and a caregiver that I could call that was 10 minutes away, and he was able to come back and rescue us. But, as you said, when we first got married, I don't think we ever envisioned that our world could be rocked by this disease that much. You think, oh, I'm in a wheelchair. I'm the quote-unquote worst case of someone living with MS,
and I'm the healthy one because I still can walk. I can still do this. I can still help you stand. At that moment in time, but thank goodness, and this is something as we always talk about in terms of your team, your caregiving team. It wasn't just you had me, but you also have Marcus, but you also have your family. And God bless your family because they were able to come up. Because obviously Marcus has his own family and can't stay here the whole time.
His own family and his own life. And so when he came back, which he did, he came back and thankfully he helped you get back from the bathroom, get your lump of a self back into bed, and he waited until my mom and my brother, thank you both, Mom and Steve, they dropped everything and they came up to help us.
Drove an hour and 40 minutes north.
And they were able, like I said, to drop everything and help us so that we could continue staying here in our house. And that was, that was something we didn't plan for. But again, as we talk about often, think about your team. We knew that we thankfully had family that could help us.
But I think this is where, and hopefully through our conversation, maybe helps you all think about your own situations and what happens. I think that's something that really hit us in the face, is like, how well prepared are we for this? Because I dare say we weren't.
We weren't, and I mean, even still now, Dan, there are realities about the disease when it strikes. You would ask me a question, had I ever experienced something where the disease just, boom, knocked you down? And the only time I could remember was when I was first, diagnosed. My first huge knock you down symptom is I experienced double vision. And I didn't see that coming, and it happened like lightning fast. One moment I could see, normal, and then the next I saw double everything. It was kind of like you with this viral bronchitis, which we later learned is what it was. You were fine. You were in bed. You weren't feeling well. But then you were completely knocked down. So we had those resources in Marcus and in my mom and Steve. So they came off, thank God we had that. But even still now, it makes my hands a little clammy because it was a really intense, nerve-wracking situation.
Well, and it didn't go away. I mean, this was a Tuesday, and then on that Wednesday, I went to the doctor, and the doctor, really couldn't find anything. He said, he did like x-rays and whatnot. And, I had my flu shot. It wasn't the flu. And because I didn't have total congestion, said it was viral and there wasn't anything he could do about it. He gave me some antibiotics, but nothing was going to make it better. And so I coughed, terribly all the time. And I was running fever. I think there was one day where the fever broke like 3 times and I could not function. I could not move. And bless your family that they stayed here till I got better, until that Thursday night. Then I'm like, I don't want to exaggerate, say half dying, but I mean, I was, I was coughing, I was running a fever, and it's like every MS symptom. I guess that was the question I had, and question for everybody out there. I mean, how often does the MS by itself just hit you? And you said like when the optic neuritis,
right?
And I had never had that, so I always thought like with multiple sclerosis, I'd feel it. We could have it come on.
It would slowly come on, gradually work its way.
Yeah, and that's how I always, anything that I have MS, solely MS related, just sort of eases its way in.
It's insidious like that, where it just gradually, slowly takes a little bit at a time.
And you're able to adjust and adapt as it happens. Whereas this, when you're sick and you're running a fever, and I had absolutely nothing. And so it's nighttime, I'm coughing, I'm, basically infecting you, your mom, and your brother here in our house.
We're spraying Lysol everywhere, Clorox wiping everything, washing our hands constantly, and my mom just got, I love you, Mom, but she just got all frustrated, and she's like, that's it. You need to go to the emergency room, because it was 10 o'clock at night. And Dan, being God bless ya, he was like, okay, I'll go.
I couldn't fight that. I mean, because there was nothing I could do.
And my brother, God bless him too, he was like, okay, Dan, I'll take you. And they went to the emergency room where
they did every test they could do. They could see and whatnot. I ended up, honestly, one of the biggest things you get when you have MS in terms of steroids is Salumedrol. I've had MS for 19 years almost, never had I had the Salumedrol. I always had just straight up prednisone.
They brought in the big guns.
They brought in the big
you,
guns,
baby.
and I had the Salumedrol.
They gave you fluids.
And they tested just everything. Then they gave me cough
Don't
syrup.
forget the X-rays.
They did more X-rays just to see what was there. I mean, excuse me. I had the arsenal that they prescribed me for medication. They had the pharmacist the next day. It just said when your mom came back, Jay, the pharmacist said, boy, that must be really sick if they're giving him all of this. And I mean, it was like a puffer and cough syrup. And
they really, again, brought out the big guns, and you didn't sleep. I mean, that was 10 o'clock on Thursday. You're like darn near falling asleep. I think Steve said when you got to the hospital, you fell asleep while waiting for the doctors to see you. But then you get your IV Salumedrol. I don't think you slept for 2 days.
No, we did not sleep because, it's like we got back from the ER at like 3:30 in the morning. You and I showered that night because I was awake. You hadn't showered in a couple days because I couldn't help you. And then we slept for quote unquote, slept for a couple hours, and I was up and I went to work that next day.
Because you're riding the steroid buzz.
Totally riding the buzz.
But this meantime, while you're at the emergency room, my mom and I are having the conversation. What are you going to do? What's going to happen? And maybe that's why Dan and I are doing this radio show right now, is for those of us living with multiple sclerosis, you always think about what if. But it takes something like viral bronchitis to make us think about the worst case scenarios and what's going to happen when your world gets upside down because of multiple sclerosis and a cold or just a cold. And maybe for any listener out there, whether you're dealing with MS or not, you need to think about those what ifs.
And I think it's the what ifs beyond, related to, but beyond the multiple sclerosis. I mean, it's just like there are things that, we talk about this, things like a durable power of attorney.
Right.
And just like, because
an action plan when your spouse can't transfer you anymore. If you have a Hoyer lift, do people know how to use it? Do you have a medic alert? I'm fortunate, we're fortunate that we have one, like a lifeline button. But what if, my cell phone hadn't gotten a hold of Marcus? Or what if we didn't have family an hour and a half away that could come help us? What would we do? Those backup contingency plans, those like worst case scenario plans. We need to think about stuff like that.
Well, it's interesting that just last night I was on a committee at church because we're looking at crisis action plans for tornado evacuations, things like that. And I sat there during this meeting and I thought, how interesting that we're always worried about making sure we have this action plan, or like if we need like a fire drill here in our house, what would we do? How often do we with multiple sclerosis think or unless we're just lazy MS folk? I mean, but in terms of having an action plan or something, because I think a lot of times, are we just at a point where we, being the big W, we, those of us in the MS community, are we just worried about getting through today?
That's a really, good point. To live with this disease, if we make it through the next 24 hours, we can say success, mission accomplished.
I wake up in the morning and I can still get out of bed and I can still see, I can do this, and I'm just like, hallelujah, praise be, and we're doing well. And to think, well, I don't care about the future. What am I going to do right now? I mean, or is this where, again, are we just bad MS people?
I don't think that we're bad MS people, but I don't think any of us, and maybe I could be wrong, any of us want to think about when the disease progresses. We take disease-modifying therapy. We eat well, we exercise. But then that's the thing about MS, it can just blindside you. as in this example, we had no idea that a simple cold, that's 7-8 days, that our life was totally out of whack, off kilter. We affected family's life, caregiver Marcus, caregiver Jen. They had to do more, with just one simple cold, which is not so simple, it's viral bronchitis, impacted and affected so many people.
Well, and I think it still has us on edge. I mean, it was just like the other day, I had done a lot, we did church, we did all these other things. My feet started hurting, and there were just like, I had symptoms that were kind of inflamed, and I just at that point was thinking, I took my temperature to make sure I wasn't running a fever, because I still have a cough, I still have some tickle, and you're still like freaked out that we're not out of the woods yet.
No, and it kind of reminds me when I was first diagnosed with MS. I would stand and I would close my eyes and I would touch my nose and I would try and stand on one foot, and that was my benchmark. If I could do that, then my MS wasn't progressing. And with you, if you're not running a fever, if you're not coughing really bad, then your bronchitis is quelled, it's gone. But you have to be, aware and thinking, if it does come back, what are we going to do? And for me personally, I spoke with my social worker, and we are talking, we have discussed some things for in the future, and I don't feel 100% at ease, but I certainly feel a lot more at ease that we've worked on this, and it's just that reality, you never know.
And it's something where you just you have to, but you can't live in fear. But it's like, how do you respond? How do you get that action plan in place? Because the reality is, during this course of whatever those 3 days, and I think it was probably the second day or something, when I was laying in bed and sleeping, and I that afternoon, Marcus was here, your mom and brother were here. I could not get out of bed, and I stood up and I could not stand, and I fell to the floor, and I had to go to the bathroom, and I think we wrote about this, but it's like, I'm sitting there on the floor, I have to go to the bathroom, but in my head, I'm not thinking to myself, how am I going to go to the bathroom? I'm thinking in my head, your family leaves, who's going to help you? How is Jennifer going to go to the bathroom if I can't help her? It's just like, and that's where I think when you're serving as the caregiver, because you're my primary caregiver, and if you get sick or if there's things that are happening, I'm putting money down trying to think for you, but I would say you wouldn't be concerned about you. You'd be thinking about, okay, how's Dan going to manage this?
And as you're in the emergency room, my mom and I are talking, and I'm just telling her, and I vividly remember, he is my everything. And that is my focus, is like, what can I do to help him? And yes, I don't have as much ability as I used to, but I know I have resources. We have family, we have caregivers, we have really amazing friends. Our friend Amy, she called like a couple times just to check on us, and she's like, if there's anything I can do to help. And I'm thinking, certainly if I need that help, I can ask for it. And I suppose, I'm scared. What am I going to do to help Dan? But if I reach out, can other people help?
And that's what, as my caregiver, that's what you did. You're the one that called Marcus. You're the one that called your family to do this, to get the help, because I couldn't do it. Then I'm feeling better, and like that Saturday, then we were supposed to have our MS self-help group. you're the one that called and canceled it, got that stuff in order, say, people, we can't do this. You're the person I was supposed to be assisting minister in church on that Sunday. You're the one who called another parishioner to say, could you assist for Dan today? That's you as my caregiver.
And I mean, not to like, oh, by the way, I'm the one.
By the way, I'm awesome, but
I'm the
tell me
one
about
that
it.
was getting juice for you, going to the store to get you cough medicine. My family was picking up prescriptions, or if there were necessities we needed. And that's why it's so important to reach out to your team of people, your friends and your family. And if you have to, paid people, you just really have to reach out. And I think that that's important. But I think a lot. But
you're a thoughtful person.
Thank you. The focus, or the most important lesson of this viral bronchitis and in sickness and health, for me, was that we are so important. We each need to take care of ourselves. And when you were sick, I had to think of my marriage vows. And you were sick, and I'm with you 100%. And what can I do to help you to regain your health?
And me, what can I do to get better? And this was just very real. And so, wow. And here we are. It's like it's still very fresh. And
very fresh and very emotional. But it gave us perspective and helped us think about a lot of the things that we're going to need to consider moving forward, living with chronic illness, living with multiple sclerosis.
And so in sickness and in health, it's really being prepared. I mean, and being overly prepared for these things to have, I don't want to say your ducks in a row, but wow. Well, thank you all. Check in with us on our website. It's danandjenniferdigman.com, or find us on Twitter. Let us know, I mean, with you as a person living with MS, as a caregiver of somebody living with MS, I mean, what kinds of things do you do to prepare yourselves and dealing with this reality? Because it's more than just, 4 words in sickness and in health?
And it is, your future. Think about it. Be grateful, as we are, to my mom and Steve and to Marcus.
Totally. I mean, forever grateful, really.
Forever. And just find your team and keep them close.
So thank you all again for listening to this. Was a couple takes on MS. This is Dan Digman.
And Jennifer Digman.
And thank you all for listening. And thanks to MS&Me Radio Network for having us. And thanks to Blue Draft Kid for composing theme music for our show. Take care.